My name is Hunter Bailey, and today I'm going to be doing the NG tube checkoff. Here's my College of Nursing ID badge, and you can go ahead and scan the room. The first step is going to be to verify the physician's orders. So there's an order to insert the Salem sump and connect to low intermittent wall suction. I'm going to verify hospital policy and perform hand hygiene. I'm going to come into my patient's room, identify them with two identifiers. So Jaguar J. Jones, medical record number 4176352, medical record number 4176352. Assess for allergies. So he's allergic to penicillin. Mr. Jones, today I'm going to be placing an NG tube on you. Do you have any questions? No? Okay, good. So then I would perform hand hygiene. I've already gathered all of my equipment that I need that's necessary to perform the NG tube insertion. I'm going to don my goggles. And I have my stethoscope and pen light in hand. So now I would raise the bed up to a comfortable working height and lower the side rail. Pull my patient's gown back. I'm going to place on the pulse oximeter to my patient's hand, or to their finger. And I'm going to also take bowel sounds with my stethoscope, and I would check their vital signs. So if there was a decrease in their pulse oximetry, or if there was a deterioration in their in their vital signs, I would stop the process of inserting the NG tube. So now I would place the patient in half hours unless contraindicated and establish a queuing sign. Mr. Jones, please raise your hand up high if you need me to immediately stop the procedure, okay? So now I'm gonna get my Salem sump and open it. And I've already gathered all of my tape that I need. My tape is pre-cut. And so I'm going to place a dollop of lubricant onto the clean part and loosen my 60 milliliter plunger. And now what I'm going to do is don clean gloves. I would perform hand hygiene. I'm going to don my clean gloves. And now I'm going to have my cameraman sit the phone down. Okay, so what I would do now is I would cleanse the bridge of the nose with an alcohol swab or whatever hospital policy was. I'm gonna check for patency, so breathe in, breathe in. Okay, so I'm going to be placing this inside the left nostril. I'm going to go ahead and measure my NG tube. So I'm going to measure from the nose to the ear to the xiphoid process, which is about right here. So once I have where the xiphoid process is, I'm going to take my dog-eared piece of tape and go ahead and place that right there for easy removal. And go ahead and coil this back up and set it down for the meantime. I'm gonna get a towel and place it over my patient's gown and get a basin to put the end of the Salem sump in and protect from possible emesis. Now I'm going to get my tube and coil it up in my hand. And once it's coiled up into my hand, I'm going to uncoil it and lubricate about 4 inches and place the end of it into my basin. Mr. Jones, I want you to go ahead and relax and flex your head back up against your pillow. I have a cup of water right here with a straw for you to sip on, okay? So I'm about to insert the NG tube. So I'm going to insert it and aim down back towards the ear. Okay, now I'm past the nasopharynx. So I would have my patient relax and then flex their head forward. Once I'm past the nasopharynx, I'm going to encourage my patient to sip some of their water. And while they sip, I'm actually going to rotate 180 degrees, advancing 1 to 2 inches each time. And if I would not push against resistance, and if my patient started to cough or their vital signs dropped, like their SpO2, or if they were in any kind of respiratory distress, I would pull it back into the posterior nasopharynx until normal breathing resumes and have my patient sip water and then advance the tube again. And I'm advancing this all the way to the marking tape Okay, so now I've hit the marking tape. So I'm going to keep this right here. And I'm going to hold it still and grab my temporary tape. And attach this to my patient's cheek as a temporary tape. Okay. So now that it is in there, what I would do is I would check for position using a tongue blade and my pen light. I would get them to open their mouth and look and make sure that it's not kinked up in the back of the throat. So now what I'm going to do is get my 60 milliliter plunger that I've already loosened and connect it. And the ways to check for correct placement is I'm going to aspirate the gastric contents and check the acidity of the contents using pH strips if indicated. And then I would also do a chest x-ray, have it performed if it was ordered. So now I'm going to take off the marking tape. I can move this back just a little bit and dispose of my marking tape. I would get my skin prep and cleanse the bridge of the nose, and I'm going to grab my, I call it my bridge tape. I don't know what y'all call it, but I call it my bridge tape. So I would secure this to the nose after I've already cleansed it and prepped it. And this kind of tape right here, this method is going to allow the NG tube to float. So now I can go ahead and remove the temporary tape. And this is already secured. So now I would get a clip and clip the NG tube to the gown, get my indelible marker and mark the exit site so I would know if there's any deviation of the tube coming out of the nose. So now if suction was ordered, lower intermittent wall suction, I would turn on the suction, remove this. Okay, so I would connect this to the suction tubing and make sure that the blue pigtail is always above the patient's abdomen. And if suction was not present, I would just recap and then hold this again above the patient's abdomen. Okay. So I'm going to pretend that this is above the patient's abdomen. So now what I'm going to do is I'm going to raise the side rails back up and lower the bed into the lowest position, but keep the head of the bed at a 30-degree angle, position my patient for comfortably, and have a call light. I'm going to clean up my mess before I remove my gloves. Let's go ahead and clean up my mess. Now once my mess is cleaned up, I'm going to remove my clean gloves, dispose of them in the trash, and I would perform hand hygiene. And now I'm going to document. So I would document the type and size of the NG tube, the time the NG tube was put in, the location. So in this instance, I put it in the left nair. I would document how the patient tolerated the procedure, how placement was verified, and how it was secured, if suction was used, and the amount, color, and consistency of the secretions. Now I'm going to demonstrate discontinuing the NG tube. So I'd come in, verify the order, wash my hands, and put on my clean gloves. So I would go ahead and get my towel, place it on my patient. I'd already have the bed positioned and ready to go. So what I'm going to do is have my basin right here, and I am going to turn off the suction, and I would also take their bowel sounds and go ahead and I could remove the pulse oximeter. So I would also take their bowel sounds, and now I'm going to remove the tubing. Mr. Jones, I'm about to remove your tubing, okay? So I can go ahead and take this off of the nose. And now I'm going to kink my tubing and remove this swiftly and smoothly. And place it in the bin. And I would dispose of this, and I would cleanse the nose. And then now I would raise the bed, the side rail back up, lower the bed to the lowest position, stuff, keep everything good with the bed. And I would take off my clean gloves, perform hand hygiene, and document. So I would measure the secretions. So I would measure the secretions. I would perform oral hygiene, and I would document discontinuing of the NG tube as well. So let me make sure I've documented everything. So I think I've documented everything. Yes. Okay. So I would already clean up my mess, perform hand hygiene, and assist the patient for comfort. And this concludes my NG tube checkoff.